Hey everyone, I'm Aaron Potratz.
And I'm Nathan Hawkins.
We are the Shrink Think Podcast.
Baby.
Enjoy the show.
It's all for you.
I was like, how you do it?
that was the...
You trailed off. I was like, wait, I was kind of enjoying that song.
You know what that song comes from?
No.
That's Wild Thing.
Oh.
It starts in it's the beginning.
Oh, yeah. There's another one that actually sounds like Wild Thing, too, isn't it? It sounds like exactly the same. I always hear it, and then I'm like, oh, that... No, it's not.
It costs $50 to make you...
I don't know what it is.
You haven't seen that song? You haven't heard it?
I did not see that song.
I mean, hearing... You do not know what I'm saying is what
I
I'm
also did not smell that color.
I need to get that song and put it on my list of things. That's
Nathan
an older
does the
song.
psychedelics.
Nathan's never done the psychedelics. Don't
He's
say
watching
that.
podcasts and smelling colors. Wow, that color is so...
Have you ever smelled a color? It's so amazing. That's so amazing. I'm tasting light right now.
It tastes like magenta.
I love magenta.
Okay.
Something's different when you whisper. It makes everything a little more creepy.
It does. Oh my goodness. Okay. Let's try this. Don't try this at home. We are professionals. Here we go.
Yeah, aside from everything you've ran into so far.
Hey everyone, welcome to the Shrink Think Podcast. We are here again today, thrilled, riveted, excited to be with you. We love having you here. We really do. I just want to stop and say thank you. Thank you for listening to our podcast, listening to the show. We appreciate that.
All the swag you buy.
Nathan appreciates the swag you buy.
I appreciate these guys.
Yeah,
We're nothing without you.
It's true, we are.
That's actually
we
true.
are nothing. We love getting the feedback from people that listen, like, oh, this helped me, or I didn't know this, or they want to dive deeper into one of these topics. So we do it for you guys because we've got, this experience, and I mean, we're sitting in our chair all day long helping people, learning stuff, and we're like, hey, we might as well share this with a broader audience. So if there was nobody listening, we would not be here. We would just be talking to ourselves.
That's true.
So thank you for giving our lives meaning.
This goes against everything we talked about in the last episode.
Exactly. Go back and listen to How to Build Emotional Intelligence. Today we're going to be talking about the role of clinical supervision and consultation in therapy. And it's, a little bit of a change from the the mental health relationship stuff. But this is what the Shrink Think Podcast is about. We are trying to bridge the gap between clients and therapists. And when you hear that title, clinical supervision and consultation, if you're an average Joe, you might be like, why would I want to listen to this?
Yeah.
Right? This is
Stuffy.
It's stuffy. It's about something else that doesn't affect me or that I don't care about. But as always, we want to give a little bit of behind the scenes for you guys to see and listen to, as well as to educate and inform some other therapists maybe that have been in the field for a while, but also especially younger therapists that are just getting into the field. And of course, if you're a client that is going to therapy, this can benefit you as well because you can understand what this is and maybe demystify it, destigmatize it a little bit for you to see that it's actually a really good thing.
Yeah, so if you're a normal person and you hear clinical supervision.
What is normal, by the way? Can you please write in and tell me? I would like to find out what that is.
I will write in to Aaron at shrinkthink.com. And
anyway,
and then you can answer.
Person,
and you can answer.
Congratulations.
Typical. How about typical? Anyway. The word supervision in your line of work, which is not as a therapist, would probably mean, oh, you have a supervisor, and they kind of tell you, they give you the parameters, what you're supposed to be doing, and they look over things or whatever. That's not really the same thing that we're talking about when we're talking about clinical supervision. It is somebody who is essentially overseeing your clinical work. And there are kind of two different venues when it comes to that. One would be you have to have it, and the other would be you choose it. I mean, that's kind of the two sides of it. When you're younger in the profession, you have to have it. And then when you are older in the profession, you realize that you want to have it because it's helpful.
Yeah, I was going to say it's kind of like you need it either way. When you're newer to the profession, you need it because there's a lot of stuff you don't know and you're insecure about yourself, and also you realize you're just getting into this field and you don't have maybe as much confidence as you want or need to have. But then if you're older in the field, you also know that you need it because you've been doing this long enough and you know that you miss things, you've got your own blind spots. And hopefully if you have consulted with anybody else and they've given you some sort of oversight for the cases that you're doing, you've realized, man, there are a lot of other ways to do things, or there's something that I usually end up not seeing or missing that's really helpful to put in front of some of my colleagues that helps me help my clients so much better.
Yeah, I think of there's a thing that a friend of mine told me a long time ago as he was getting his second doctorate. He said, you get your bachelor's degree and think you know everything, and then you get your master's degree and realize you don't know anything, and then you get your doctorate and realize no one knows anything. So it's this idea of like, as you grow in the beginning, you have to come to terms with what you don't know, and then you have to kind of hold that and know that. And then as you do that, you start to realize like, oh, I need to really resource with other people because of what I don't know. But also, the more kind of in some ways, there's a limit to this, but I was going to say the more the better. So getting people with clinicians that you trust. So you've in my mind moved out of the place where you have no choice but to be supervised, or else you can't be licensed as a therapist. That's at least nationwide, and I want to say with KCREP that's worldwide. I'm just sitting here thinking of, I wonder if there's any places going, I don't do that, like other countries.
Well, you should.
Yeah, you definitely should. But so if we back up, when you're getting your master's degree as a counselor, for those of you who don't know, you have to be supervised at the university. So there's a class that you take called clinical supervision. So you are working at a counseling site somewhere, and you go to that counseling site, which is not at the university, and you do counseling. And then you go back to the university and you take this class that's happening, I think, more than once a week, usually. Maybe once a week, actually. Yeah, once a week. And you basically, the professor's there, and you basically talk through cases, and they make sure things are going. At the same time...
And let me just say, also, it's in a class with other students, right? And the students are given feedback. The professor is usually asking the class to, think critically about stuff or to see what is not being seen, sort of to practice on a larger scale in a classroom what supervision is all about.
Yeah, and Aaron and I have taught classes like that where I've done some adjunct faculty where I've done that for semesters. So that happens there, but at the same time that's happening at the university, that therapist in their master's program also has a supervisor that is on site at the counseling center. So they have somebody there that they have to meet with once a week. So there's a lot of oversight because the field knows that these younger clinicians need to learn, and we have to have more clinicians because at some point people die. That's just real.
And I just realized maybe we should say newer clinicians for the listeners out there. I think we often think of younger clinicians as being young in the field.
Oh yeah, that's true.
But I think people might hear that as they're young, right. And that's not true. I've had many interns who are midlife or older, 40s, 50s, 60s, as a second career, and so they might just be newer in the field.
Right. Yeah, so there needs to be a process to grow people like that. The same with any type of profession. But the reality is we're dealing with these things called these real people that do actually need help and are coming in and we're not experimenting. We're not going to experiment on you. So there needs to be a lot of oversight to make sure that things are going the way that they should be going. But the cool thing for you as a person who might be a client, if that's you that's listening right now, is you've got all these people, these clinicians, and your name is never used, to be honest. Like Even when ethically and legally you're allowed to say the name, everybody's in a habit of not using the name.
Yep.
Just so you know, I know it might be interesting and weird, but it's true.
Nobody cares really. They don't care the details of that. They want to dig into like, okay, what's going on? What's the issue? What's the stuck point? What's the context? Who is this person and what are they working through? So, and how can we help them work through those issues more successfully?
Right. And so what's happening for the clinician on that side, supervision wise, is they are in the beginning mainly learning about this technique that doesn't work, or this thing that works in this situation, or this is how you want to apply your theory, because there's different theories of practice. We're not going to get into that. It's too deep. But they're also learning a bit about themselves, because that's where we've talked a lot on this podcast about self-awareness and that kind of thing. There are things that come up where the supervisor is looking to help the supervisee, this newer clinician, understand that they're who they are, and their automatic understanding of things is going to come into therapy, and that can be a problem.
It can be good, right? If you have a certain intuition or skill of relationship, those can be really beneficial. And at the same time, there are certain skills and techniques that are very unique and specific to being a clinician, being a therapist, that you have to hone and develop over time, which means being aware of some of those automatic default things and changing or adjusting those. For example, I remember going through this class and people telling me that I had these facial expressions when people were saying stuff or whatever, just me as a person. And I was young, I was in my mid-20s when I was going through my grad program. And I had all these facial expressions that I was giving, and people were like, I think you might want to work on that. They gave good feedback in the sense that they were telling me clients might misinterpret that. They know who I am, but your face is going to give a lot away. And so I remember learning that you need to control some of your expressions because your automatic reaction might not be the correct one. And so I remember going to my private practice and literally practicing managing my facial expressions and being hyper aware of what my face was doing in session every day, every hour for weeks or months at a time until I could kind of hone that. And then just recently, within the last couple of months, I remember somebody said something like, you tend to keep a pretty, even facial expression or whatever. You don't react to things or whatever. And I was thinking, oh, that was the result of a lot of practice and training. It just is so normal to me now because I do it all the time. But that's one of those skills that has to get developed.
Yeah, I remember in my own development in class, Dr. Daniel Sweeney, he's still out there. There's a call out, buddy. You know what I'm saying? I know you're listening. He was talking about how you can't counsel out of your intuition. And I mean, he was not totally calling me out, but it was a classroom setting. So he was just calling it out a little bit. Not looking at anybody in particular, can't. But, and so, cause I'm a really intuitive person. But the reality is that if you're going off of your intuition, there's problems there because, as I tell people now, because as a client, a lot of people, and this is not true for the people that won't listen to this show, but because we know this, but they kind of think as a clinician we have these weird super wizardry powers, and that's not true. So people come in they come in and go, "You tell me." And whatever it is,
what am I feeling? What am I thinking?
Right. And so intuitively, it's kind of fun to feel it and then be like, oh, I bet you this is what's happening. But what I tell people now is, okay, here's the deal. If my intuition said that you need to go to the beach because that's where the direction we need to go, and then I show up at the Oregon coast in this town called Astoria, which is to the farthest north of Oregon, and you look out there like, wow, yeah, this is kind of rocky like the beach. I don't remember there being a Columbia River touching the ocean here, but it kind of feels right. And really what we should be, if we followed your intuition, was over at Brookings, which is almost at the southernmost coast of Oregon. In other words, there's a familiarity where I would have been kind of right if I just followed my intuition, but it's so wrong because it ends up being confusing and unhelpful. But my joke back to Daniel Sweeney at the time was, because he always talked about he's not intuitive, and I'm like, well, you only say that because you don't have one.
Was that the class you failed?
Yeah, I don't think I've had one of those. Yeah, so
that's why you had held back.
So, but it was really hard for me to distrust my intuition, to not ask questions from it, right? Because I had all this, so I had to give back to the theory that I was in and intentionally ask about that rather than ask because I had a thought or I had an intuition about whatever happened to me. So what supervision does is it helps these younger clinicians or newer clinicians to see things more honestly, to see themselves more honestly in a situation. And what happens as you grow, so now you've got your license, or maybe you've got your license and you're practicing on your own. You don't technically need supervision. You start to also realize the value of other clinicians, like, because you'll see somebody, it starts to where you're at a conference, you're somewhere, and then somebody says something, and then you realize, like, oh, I wonder what this person would say about this other thing. And then you kind of realize, like, oh crap, I probably should make a supervision group because I'm so desperate to understand these situations from different angles, and I have no one to talk to.
Yeah, I think there may be a little bit of a process that you can go through that's really common is you start out thinking, oh no, I'm doing it wrong because that person over there is doing it this way, or the other person in my supervision group is doing it the other way. So there's like I think a natural insecurity to distrust yourself, to feel like you're doing it wrong because you don't necessarily know what you're doing. Like you don't know that you know, right? You know what you're doing, but you just don't have confidence in your ability yet. And so you hear somebody else and they're like, oh, I should be doing it like them. But the reality is they are doing it the way they would do it, and you need to do it the way you would do it. And so you move from this insecurity to like, oh, there are lots of different ways to do things depending on who you are, your personality, your style, and the way I'm doing things is good, is fine. And I can trust myself that I do know what I'm doing and I can do it in my own way. And getting these other perspectives from other people is just seeing things from other perspectives. It doesn't mean becoming somebody else, doing things the way Daniel Sweeney would, or like, oh, well, Bezel van der Kolk would do this, or, you know, Esther Perel would do this. I need to do that too. It's like, well, maybe they can get away with that because that's who they are. You need to find your own variation of that, your own version of that as a clinician. And that's what supervision helps you to do, is to see yourself and to try new things or from a new perspective in your own way so that you're still authentically yourself.
And it helps you as a clinician to encounter your blind spots in a safe way, because you're not getting like, wow, you're horrible at this, or oh my gosh, like you need to just go home. Like, I don't know why you did this. Although, to be honest, that supervision does work as kind of a gatekeeping process to this profession, because there are people that do not belong in this profession. Just like any other job anywhere else, it's like, bro, this may not be your thing.
Or you need more work on yourself before you can be considered to be here, because you are a person as well, and you're influencing negatively that process.
Yeah, so it does work to do that. But on the other side, as you start to encounter the fact that you have blind spots, then you remember that you have blind spots. That actually doesn't change. Like You just grow and you're able to realize, like, oh, let's just go ahead and bounce this off of somebody else, because, like, for example, it can be dangerous to like a client. And what I mean by that is, you feel really friendly, like, oh, I could, go have a drink in a bar with this person, or like that'd be cool to hang out with them. And you're like, you kind of look forward to it. Well, if that's the case, there's other things that you can walk away from clinically that you just don't pay attention to, because you're like, oh, that's just not who they are. I don't want to offend them, or whatever.
Or you just get so comfortable that you're overlooking things that you're normally really sharp about.
Right. So you bring this stuff up. You might even say that in your supervision group. Where these other, at this point, we're saying, like, there's a group of clinicians in various positions in their professional growth. Some are licensed, maybe some are not. And then you're just like, okay, if I'm honest, I know this liking a client thing could be a thing, so I'm just going to go and bring it out. So you might put out to the group, okay, there's this client that I like, feel like I could hang out with. This is their situation. but you're highlighting your own bias up front, right? And then you're putting the thing clinically out there for folks. And then so you can hear back from the group how they would look at it clinically, because they don't have the relationship, like in that example, that I do, let's say. And that can help to re-engage your own clinical mind and like, oh my gosh, like this is what I'm missing. This is what, okay, I need to be helpful to this person. That's why they came. It's great that they have a good relationship and we have a good relationship, but we have to be able to use it to help them.
Right, so that I can make an adjustment in how I'm doing counseling with that person, so that I might like them, so to speak, but I'm still keeping myself sharp. I'm like, okay, we get along, but I'm not going to just chit chat, or I'm not going to just get too comfortable. I'm going to make sure that I stay sharp with that person. And there's kind of something along with this too, is that it develops some critical thinking. As you are in this group, or you're getting oversight or challenge from other people. I know in our consultation group, people are regularly asking, why is this so challenging for you? Or where are you stuck? Why do you think you're stuck? It's outside people inquiring about you as a clinician to help you kind of introspect or self-evaluate, or to think more critically about the situation beyond where you are currently, or where you have a habit of thinking. So supervision can also help you as a clinician develop more critical thinking, or as you're hearing your group members do some thinking about something, you might be thinking critically to yourself, just listening to them of like, oh, I don't think that way, or oh, I don't pay attention to those things. Maybe I need to pay more attention to that. So it just helps, I think, develop you out in a more roundabout way.
Yeah, with professional accountability that occurs inside of that, it kind of holds the what's the word I want to look for? Like the structure, I guess, around the idea that we're doing a clinical thing here, right? Which automatically highlights the potential ethics involved. Because if you are, one of the common things that comes up is inside your own head, you might have these ideas of like whatever you're doing, whatever you want to do, blah, 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 blah. And there's a part of you that goes like, is that unethical? Like, and other clinicians are really the only ones you can ask about that. I mean, there are things that have nothing to do with bad or good ethics that as a quote unquote, like, well, as a non-clinician, you might think like, I can't believe that. But reality is like, well, it doesn't have anything to do with like the legal ethical side of things. So you would need to bring that up with other clinicians. And it feels a lot safer because you can say, okay, am I off my rocker here? Like, this is what's going on. And then you get the good questions back, the feedback, to where you've been critical thinking, right? But critically thinking. But now in this situation with that accountability, you realize just in the structure of the moment, like, I got to be honest with myself and I got to put this out there, which helps everyone, right? It helps the people that you're going to be with like the next week. And like what Aaron and I were talking before this, that just being, even if I don't bring a case up, meaning like your specific, like you client A specific case, and I don't really ask as much, maybe let's say in one supervision group, I'm gleaning from everybody else's interaction and applying, other clinicians might have similar cases and they say something and I realize like, oh my gosh, I'm doing the same thing with that person. And so that accountability to that really can help.
The thing that's, I guess, as we just head for home here and close up, that is, if you're a client and you're hearing this, again, it's like, okay, this is a lot about the profession, right? Which is fine. It's kind of some behind the scenes. What I want you to take away from this is, what we want you to take away from is that if you're a client and you're seeing a clinician who's got a supervisor, or they're in a supervision group, or they're in a grad program, they might have some underdeveloped skills, or they're developing some of these skills. But keep in mind, they still have the natural ability, they still have a lot of training and education, and they've got a lot more experience than an average person. What we want you to see here is that there's a lot of oversight, a lot of accountability, a lot of work that's being done on this person professionally to help them help you. There are a lot of people that are investing in this clinician, or in all the clinicians really, but in this clinician for you, for your benefit. So if you're a client that's going to a therapist that is getting supervision, or if you're just with a therapist who's been in the field quite a while and they're in a supervision group, you can rest assured that they probably have brought you up, or they will bring you up if something gets stuck. And I know, Nathan and I, we've done this many times, and I can think of many instances where I've been stuck with a client, like, I don't know, there's something going on, I'm missing something, or I can't get past this. And I'll ask our group, because we've been meeting for like 12 or 13 years now, and the group will ask some questions, and it'll help me see something about myself. Like one time I was like, oh, I was kind of afraid of this thing. And as I worked on that in myself to not be afraid, I could lead the client forward in whatever they were going through because I was no longer afraid. Or sometimes it's like, oh, I hadn't thought about this other perspective or this other technique that I might need to use that's more effective for that case. In essence, if you're a client listening, what you're hearing is that you're getting so much better care, or so much more care with the help of all of these people who are looking out for you.
Yeah, and you can use this, right? So you're probably very familiar with the idea of getting a second medical opinion, right? You have something going on and it's significant to you, and you're like, I need a second opinion on this. So you can do that. Like if you know your person's sitting there, they're underneath supervision, or if you're not sure, you could, because now you understand what the heck this whole supervision thing is, you can just ask, like, hey, are you participating in clinical supervision? And they're like, oh yeah, I do actually, about once a month, or maybe they're having to do it once a week. Hey, would you mind asking them about, I'd be curious what their feedback would be. Like, I appreciate what I'm getting from you, but I'm also wondering if I'd like to hear directly from the source, if you could kind of report it, like, I asked this, and then they said this, and then you could talk more about that. It's this interesting thing where you don't just have a second opinion. You in that situation you have quite a few.
Yeah. Right. Let's not put a number to it.
Right. Exactly.
We don't want to overwhelm you.
Right. There's good. 400 people. That's definitely.
It's like that Seinfeld episode, right, where somebody's getting surgery and like Kramer's up above, and they're watching this thing, and it's like all these people are like, hey, come around, look at this, look what's happening. Have you ever seen this before? No, I haven't. Oh, let's take a look.
Yeah, it makes you feel like, yeah, we're not talking about that.
It's not quite like that.
So what hopefully you can feel confident about this whole thing of what it is, the supervision thing, and even more confident, for example, seeing newer therapists, because they do have a natural ability and they're developing it, and you've got a lot of help in the background. So buy some swag and have a good day.
That's hilarious. It's all about supervision. Make sure you buy some swag. Because that makes sense. For our pocketbooks.
The timer's 3 minutes behind?
Yeah. Oh, I didn't stop it. I didn't start it for like 3 minutes.
Okay. Well, I clicked in on it, so I was looking at it like that.
Yeah, I know.
And then
I was like, oh, look at mine. Yeah. I need to start the timer and then hit that.
I thought you were telling me that I need to get back to the subject. I was like, I think I'm on the subject.
You were like, what am I not? I'm saying all the words of clinical supervision. I'm talking about grad programs. Like, what the heck is he?
I'm like, I need to abandon everything I'm doing. Where does it go? Where do I go?
It was great. I thought you did a fantastic job. This is where I'm like, this is your zone right here. You talk about that stuff, and you were just dialed in. You described it perfectly. I think that was.
Thank you very much.
Hearing it as a listener, a grad program, or a supervisor, or whatever, and thinking like, oh, this is great. This is really valuable.
I was thinking, it probably would be. I don't think it would work, but for people that are newer people coming in, the people that are like, yeah, I'm just picturing I get a phone call. This happens all the time. You get a phone call and they're like, person's like, oh, do you have anybody available? Oh yeah, this person. Oh, they're an intern. Oh, what? Oh. Well, they don't have experience. But I'm like, let me explain something. And then I'm like, hey, listen to this episode. Yeah. Like, that's not going to work either. Would you consider listening to a 25-minute episode right now? Yeah. Oh my gosh. But it would be cool actually to put a link on my website actually to this episode in regards to interns on the intern page. That's true. I totally should.
That's a great idea.
Yes, I'm going to do that.
Do it.